Hi, everybody. This is Irfan.
Hi, and I'm Yona.
And we've been hearing a lot of questions from you guys about COVID and coronavirus, COVID-19. We thought we'd take some time to help address some of these questions and help you understand what's going on with this whole situation.
Please listen today and let us know what you think of this video. And if you have other questions that we didn't answer, you can also get in touch with us and ask those questions, and we'll try to answer them.
What are the
So here's
first
our first
questions?
question.
Yeah.
Go ahead, Irfan.
The first question that we're getting is I'm hearing so much on the news and it's so confusing. What is happening?
So what we're hearing about in the news is we're hearing about what some people call coronavirus or COVID-19. And we're hearing about a lot of people who are being sick. And also we're hearing about a lot of changes we need to make sort of in how we're living day to day, where we can go, what we can do. And I think that can be really upsetting and sometimes scary for people. So we wanted to talk a little bit about what kind of symptoms or what we might feel if we have COVID-19 to help people understand a bit more about it.
Yeah, so symptoms we've been hearing are things like, I guess, a fever, um, really high fever, dry cough, so something where you're not bringing up any stuff when you're coughing. It's just you're making the loud sound that comes with the coughing, but nothing's coming up. And then people are having some muscle aches as well. And I think those are the most common symptoms that people are having when they're having sicknesses or illnesses with COVID.
I think we have a picture showing some of those things. Irfan, do you want to show that?
For sure.
There we go. So the three things that people are worrying about the most, I think, so the cough is a big one. And you'll notice how this guy's coughing. And these are photos actually that came from Surrey Place with some of the self-advocates that we work with there. So he's coughing right into his sleeve to make sure he's not spreading it. And then we see that high temperature, the fever, and also really difficulty breathing. And you mentioned also the soreness sometimes in your muscles. Sometimes when you feel like you have the flu, you feel kind of all achy and kind of woozy inside.
Yeah.
So I guess that's another symptom. It's tricky though, because it's the same really as what you'd feel like when you might have another kind of flu. So we don't really know that it's COVID or that it's another kind of flu.
Yeah.
But certainly people feel unwell. But some people just feel like a little bit unwell. It lasts for a couple of days and then they're okay. Some people actually, we don't even know that we're feeling it because we're not really showing symptoms or feeling sick at all, but we still have it in us.
Yeah.
And the important thing is we can still spread it when that happens, right?
Exactly.
But there are some people who we really worry about if they get these symptoms, right, Irfan? So who would
for
those
sure.
people be?
And I think the people we're most worried about, from what we've been hearing, is those people who are older. So anybody about maybe 65 years old or older than that, or we're really worried about them because they can get really, really sick and need to go to the hospital if they get COVID. Another group of people are people who have other health conditions or other health problems that make it more likely for them to become very sick with this disease. So those are, I think, two big groups of people where we really want to avoid them and stop them from catching the virus, or and because they can really, really fall sick and need a lot of care in the hospital to make sure that they don't get worse.
Right. And I guess we're kind of thinking about how to help those people who can get really sick not get sick, but
Hmm.
also making sure that people don't all start to feel sick at the same time. So we're doing a lot of things to try to slow down how much different people get sick at the same time. So this is a question a lot of people have been asking. What is it that we need to do if we don't want to spread COVID-19 to lots of people? And if we want to make sure that the people who are older, or who maybe have different kinds of illnesses already, that they don't get sick. So what can we do to make that not happen? So we have a couple answers for that one.
Yeah. And the advice that's coming out everywhere is lots of personal hygiene things. What we mean by that is one of the biggest things that you can do is making sure you're washing your hands really regularly. And we want to emphasize how people wash their hands can make a big difference. So in this case, we suggest washing your hands with soap and water and long enough to sing the song Happy Birthday 2 times around. So singing the entire song of Happy Birthday while you're doing washing your hands, getting all in the nooks and crannies of your hands and just making sure you're getting all cleaned up that way is a big thing. Something else that we want to also encourage is making sure when you're coughing or sneezing to do that in a way that avoids spreading germs. So one of the best ways is again using your elbow to cover your mouth that way. and stop those germs from spreading. What are other things that we should be doing?
Well, I think, I mean, the really the most important thing is for sure that washing of our hands and doing it so carefully in our whole hands, right, for a long time.
Mhm.
And we would want to do that every time we come into our house, every time we cough or sneeze,
Yeah.
every time before we're going to be eating, every time when we're going to the bathroom. So a lot of hand washing. You cannot hand wash too much,
Mhm.
right?
Exactly.
And for sure, if you do have coughing or sneezing, like what you said, making sure it's going into your sleeve and not sort of out there at other people. But what if somebody doesn't realize they're about to sneeze and all of a sudden they sneeze and they don't have a chance to cover their mouth? So that's why you see in the picture here of the two people standing near each other, and one person kind of sneezes or coughs on the other person. That's why we're trying to keep our distance between each other.
Yeah.
So in case somebody is like talking and a little bit of spit comes out of their mouth or they cough or something, we don't have to worry that we're close enough to them that those germs from COVID-19 will get onto us and that we'll have them. So you see the drawing of the woman with her arms standing out? That's kind of showing how wide we want people to be standing apart from us. So we really want to keep our distance from other people so that if somebody's sick and they don't know they're sick yet, we don't have to worry so much that that sick is going to come to us. Or if we're a little bit sick, but we don't know it yet, we're protecting other people by not being as close to them.
Right. It's playing this whole really better safe than sorry um, idea of like, okay, keeping those precautions and making sure we're taking care before something happens. Things to avoid, I guess, like that's some of the talk that has been happening right now. Like, what should we not be doing while all this is going on? So,
Yeah, and these are some really nice drawings that we got from Talking Mats in the UK. But it's just a bunch of reminders of lots of things we like to do that we usually do that now everybody's telling us we shouldn't do. So one thing is some people like to go, I know I like to go to synagogue sometimes on Saturdays.
mhm,
Somebody might like to go to their mosque or to their church. But those are places where everybody sits close together and prays. And if you're sitting or you're next to a lot of people, then that's one way you can spread this virus. So all those kinds of services and things are being canceled. And even that like favorite idea of going to a restaurant or a cafe and just visiting with a friend and having a chit chat, you'll notice even if you see a restaurant that you like to go to, now it will be maybe just takeout only because they don't want people to be sitting around and sharing food and being close to each other in a restaurant because that's another way it can spread.
sure. And again, sometimes even to get to all these places, we need to use the bus or the trains and things like that. Another place where people are all gathered together. So something else to avoid there. And yeah, lots of concerts or sports things. Again, we understand that these are things that people like to do, but they're very right now bringing people close together, and that's something that we want to avoid. Um, so that's why a bunch of things that we're recommending not to be doing right now. And sometimes that even means not visiting people who don't live with us. So these are our friends and stuff like that. Like some people like visiting them on the weekends and things like that. Um, but that's something that we want to avoid right now because, again, just trying to stop that spread of germs.
Yeah, and it is really upsetting. Like if you have a birthday party or something and nobody can
Mm-hmm.
come, that is going to be really sad. Or if you can't see your favorite
Sure.
relative because you can't go visit. But for now, we're trying to connect with people without seeing them, maybe just talking to them. So, but here's the big question. A lot of people are getting kind of worried. Well, what if I have COVID-19? What if I'm not feeling well? What am I supposed to do? I think I'm feeling sick. I know for me, when I start to worry about this, I start to almost sometimes feel like I am really sick.
Yeah.
If I am, even if I'm not, just sometimes when I worry, it starts to, oh, I just
Mm,
noticed that I had like an itch in my nose, or I think
mm,
maybe that's a little bit of a cough. What should I do? Right?
yeah.
So we got 4 things here we can go over.
Yep. So one of the first things where we would say is that, like, if you're really feeling sick, the first thing we do is to stay at home more so, because again, trying to avoid spreading those germs and going and spreading them while you're outside. Um, Using tissues to sort of clean your nose over sneezing and coughing and throwing them away. Um, Again, like you can see, this lady's using tissue in her nose. Um,
And remembering also after you use the tissue and throw it away,
Wash your
wash your
hands.
hands.
Yeah, good point.
Happy
Good point.
birthday or your favorite song, right? But
Yeah,
making sure you clean your hands after you do that.
definitely. And then again, avoiding touching other people, or if there is any sort of touching happening, washing your hands a lot before doing anything else. And in the same vein of keeping everything clean, keeping objects and surfaces clean.
Yeah,
virus can still
doorknobs
go.
are a big one. The kitchen counter, or places where you're working with food, places that we touch a lot are the kinds of things we really want
Yeah,
to keep clean.
any sort of
So,
washroom counters and stuff as well. Like, yeah,
yeah.
those are if you're sick, generally. I think another question is like, what if I think I have COVID-19 and I want to get tested for COVID-19? What should I do then?
Yeah. Yeah, a lot of people were asking, I think I want to get tested. How do I know I got to get tested? And so we're giving the same advice here as the advice that we're hearing. And it is that the first thing you're going to do if you're worried that you're sick is you're actually going to make a phone call. First of all, you could call your doctor. Maybe let's go to the next slide for 1 second or fun, and then we'll go back. So if you have a family doctor, even though they may not be seeing you in the office right now, so they're trying to not have so many visits face-to-face, just for the reasons we've been talking about, that doesn't mean you can't make a phone call, right? So you can make that phone call, leave a message at the doctor's office to say you're not feeling well, tell them what's going on, and then they can call you back. Or in this picture, they're actually talking together, kind of like we're doing now,
Yeah,
right? Where they're having a
video.
conversation with the doctor on the video. So the doctors can talk to us on video or by phone. That's a really good person to talk to. And then the other people we can talk to are the people at telehealth. So in Ontario, we have a long phone number, and we put it here. That's Telehealth Ontario. And many other provinces have a shorter number, 811. But these are nurses and doctors who are there to answer your questions and to help you figure out what to do.
Yeah.
But it's really important. I think sometimes you think, oh, I'm feeling sick. I better go see my doctor. Or maybe I should go to the hospital because I'm not feeling well. Imagine if all these people who are not feeling well all go at the same time to the doctor's office. What happens is all the people who are at the doctor's office might get sick from the other
Yeah,
people, right? So that's why
exactly.
we start with a phone call. And when you call, they're going to ask you questions about how you're feeling. They're going to ask you about the things we talked about before, about the cough,
Yeah,
about the fever and the muscle aches. They might also ask you if you've been near anyone who has also been sick,
mhm,
or they might ask you about whether you've been traveling recently somewhere else where people might have been sick. So they're going to ask different questions to you, and then they're going to tell you what they think you need to do after they ask you those questions.
exactly. Yeah, and they're asking those questions to be able to help you and decide what's the best next steps for you. So great point there. Talked about your family doctor. Yeah, so then the next thing is sometimes once you've talked to the doctor, they'll tell you to do different things, and people have been using these words a whole lot. But what do they mean? Like, what is the difference between quarantine, self-isolation, social distancing? Lots of really big words that are not that easy to understand. So let's take a
They're
moment to
not
sort of.
words we use all the time, right? So,
Hmm.
but we're hearing them a lot now.
Oh yeah, for sure.
Okay, so I'll talk a bit about social distancing, and then we'll
Yeah.
talk a bit about what happens if the doctor or nurse tells you that you should do self-isolation or quarantine. So social distancing says you're not sick right now, but you want to make sure that you don't get sick, and you also want to make sure that the other people around you, especially we were talking about people who are older or people who might already be sick with something else,
Mhm.
that we don't want them to get sick, right? So
Yeah.
we're all trying to keep space between each other. And you see in this drawing here, they actually usually everybody sits in the chairs, but now we're going to keep space between other people in those chairs. I've seen when you go to the grocery store, instead of everybody lining up really close together, they might let only a few people into the grocery store at a time, or they might have people stand further apart in the line so that they're not close enough that they might cough or sneeze on each other or share their germs, right? So really keeping space. If you're going for a walk on the sidewalk and somebody's coming down the sidewalk, kind of moving away or moving to the other side of the street, that you're not walking right near each other. And all these
Right.
things are called social distancing, ways to keep our bodies further away from other people's bodies and like not being in big groups with lots of people.
Yeah, because the moment you're in a big group, you can't keep that same space, right?
That's right.
And what about self-isolation or quarantine? Basically, both of these two words suggest that you have to say stay at home. And these are things that the doctor or nurse will tell you as things to do in case you may have symptoms of the disease. You'll be told that you need to be at home. And then the difference between self-isolation or quarantine, self-isolation is where you think you have the disease because you have symptoms, and so you have to stay at home so that you avoid spreading germs to other people. Like you can see in the picture here, this lady is staying in her apartment, and the timeline that that has to happen right now, or the time, is about 2 weeks' time for COVID-19. That's the advice that we're getting, is 2 weeks of staying at home and trying not to interact with other people. and trying to avoid that spread of germs.
Yeah, and that's because it might be in the first few days, you don't even feel any symptoms really, right? But you're still contagious. And then you might start to have some symptoms, and then the symptoms start to get a bit better and you don't feel sick anymore,
Right.
but you're still contagious. So we keep that whole long time of the 2 weeks to
Right.
make sure that we're not spreading it to other people.
Exactly.
And quarantine really is the same thing, isn't it, Irfan, as self-isolation. You're still staying home. You're not going out.
Yeah.
You know, if you need to get food or you need to, you know, I don't know, get your medicine, someone's bringing that stuff to you, but you're really trying to stay away from other people. The difference is that someone would say you're in quarantine now because they already figured out that you do have COVID-19. But it's really doing the same thing as you would do even if you don't know if you have it, if you're not feeling well. So once you're not feeling well, if you have it, or even if you're not sure if you have it or not, the trick is 2 whole weeks to stay so you're not in touch with physically, so you're not near other people.
Other people, yeah, staying. And sometimes, especially if you live on your own, this isn't too bad because you sort of have your own living space. But if you're living with other people, this can be a bit challenging. So that sometimes can mean staying in your room and, you know, people bringing you the things that you need in terms of food and whatnot. Sometimes you have to use your own washroom. So it can mean some big changes in the way you do things. But the good
But it
thing is
doesn't
it's
last
for a short
forever.
period.
It's
Exactly. It's a
2
short
weeks,
period.
right?
It's 2 weeks time and then back to normal after that once you're feeling better as well. Yeah. So what do we do
All
to
right, and
keep
then
busy in all this time?
that's the big question, right? Because everybody's like,
Yeah.
what am I supposed to do? My dance class is canceled. I can't go to my sports practice. You know, I don't
Yeah.
get to go to church on Sunday. Like, what am I supposed to do? So we have
Yeah.
different ideas here of things that are still safe to do, even if you're trying to have social distancing or keeping yourself not so close to other people. So you could, and again, these come from Talking Maps, these pictures, you could be in your garden or in your backyard. You could go for a drive with the people that you're already living with. You might read something. You might watch a video like this video or other videos. There's so many of them that are on YouTube and, you know, Netflix and things like that. You can, if you know how to ride a bike, you could totally do that. I can't ride a bike, but I am doing a lot of walking. And there's so many games to play, aren't there? There's games you can find on your tablet or your computer, but there's also old board games, or you can
Games,
make board
puzzles.
games.
Yeah.
Scavenger hunts. I've seen people like kind of
Okay.
hide things in different parts of the house, and then you have to go and find them.
That's cool.
Um,
Well, it's right
Memory
around the
games,
season.
or
Yeah.
charades. You know, you can act things
Bingo.
out. Yeah, I've even seen people like singing like with a choir on video where other people are singing all around, and everyone's like doing the songs, and dance contests you can have. So different things that you can do where you're still not really close to other people. And we'd love to hear more of your ideas of things that you're doing that are keeping you busy, but also keeping you safe.
A bunch of people, even like those people who are more sporty, I guess, like these nice exercise videos. So lots of different things that you can follow along and do.
So here, some people are talking about how they're feeling kind of worried about, you know, if they have enough money to be able to buy the things that they need. So some people might go to work and then they're told, actually, you shouldn't come into work anymore because we're trying to keep people not near each other, or we don't need your help right now, or we want you to stay home. And that can be hard if you don't get the money from your work. And I think that can be scary for people. So that was a question that we heard.
Yeah.
And there's no easy answer for that one, except to say that whoever it is that usually helps you with taking care of your money and paying your bills and that kind of thing, that's a really important conversation to have with them. So you might have a worker or someone in your family that helps you with money. It's also something, if you do have like a meeting with your doctor, even if it's a phone meeting, you can remind them of that as well. The government is trying to come up with ways to help people who can't go to work or who don't have enough money to do things. So they want to make sure that everybody can pay for their medicines, that everybody can get food, and not to be afraid that you have to go out and do things that are not safe just because you don't have enough money for it. So it's a really good thing to talk to someone about if you feel worried about your money. And also if you get like a check, you get your ODSP check if you're in Ontario, or you might get another kind of check from the government if you live somewhere else. You want to make sure you don't spend it all at once, because you do want to be able to pay for things that you need.
That's what getting that help in managing your money step at this point. next question that some people were asking, sort of in a similar um, note, is I don't cook, but some of the places I like to go to eat are not open now. And what sort of food should I be buying? So one thing that we'll want to highlight here is that grocery stores are still open. They're really well stocked. So you don't need to go to the grocery store and buy everything that's in the grocery store and have that all stored in your house. You can buy periodically or regularly, I should say. But it might be a good idea to have a little bit of a system where you have a grocery list of these are the things you want to buy and go not as often as you might be used to going. So you might go maybe once a week or once every 2 weeks, depending on the types of things that you. And again, if you really need help, reach out to the people who are supporting you. So if that's your family members or your workers, they can help you sort of arrange and organize some of those groceries, even if that means somebody else picking up groceries for you, especially if you're sick and you don't want to go out.
Yeah, and it's even sometimes in different places, different neighbors are helping to get groceries and things like that too. So if you really aren't feeling well, or you're scared because you think you might get sick and you want someone to help you with some of that, that's a good thing to talk to about for people who are in your neighborhood or workers or people, friends or family that you have. But I think it's a good point, Irfan, not to buy too many groceries. Some people get really scared. COVID, I have to buy everything in the store. Well, if you buy everything in the store, first of all, you run out of money, but also other people will go to the store and the shelves will be empty, right? Which happened a little bit this last week. So we want to make sure that people don't buy too much so that we have enough food for everybody. And also you don't want to buy things that will go bad because you didn't have a chance to eat them because you bought so much at the same time.
Yeah, that makes sense, that you want to use your money wisely. Okay. How do you go about getting groceries and medication?
Yeah, we talked a bit about how you might ask someone to help you. There's also different ways that you can order sometimes some of these things online or on the phone. And here's a picture of somebody calling the pharmacist. So if you need to get your medications, and usually you would go in, but maybe you think instead of going and standing in line, you want to call to make sure they have the medications that you need. You can talk to your doctor about it, but you can also talk to the pharmacy, the drugstore, and they'll try to do a really good job of making sure you have enough medication so that you can pick it up or that somebody can get the medication for you.
Some pharmacies, I think, can even deliver the medications to you depending on what they offer.
Yeah.
This is
so here's a question that somebody asked. It was a hard one. They said, what happens if there's somebody that I love, and it could be that they're in the hospital, could even be, for some people, there might be somebody who's in a long-term care home or what we might call a nursing home or a retirement home, and then they say, well, there's no visitors, right? Or maybe someone in your family is having surgery and you're told you can't go, or somebody just had a baby and they're in the hospital and you can't go. I think that was really hard because usually everybody's allowed to have visitors, right? And we all know that when we have visitors, it makes us feel happy, right? So we might want to bring stuff, we might want to see them. So I think that can be hard. It's important to remember that the reason why we're not having visitors so much at the hospital and at some of these places is that we don't want to bring the germs in that will make people sick with COVID into the hospital, right? So we want to try to take care of not having too many people in the hospital at the same time, especially if they might be sick and they don't know that they're sick yet. So there are things you can do. So here you see some pictures of like calling. You can always call. For sure, you can call the person that you love that's there and still talk to them and see how things are going and stuff. If you're scared they're sleeping and you don't want to wake them, you can call the nursing station. So there's usually a phone number on the floor where your family member is. And if you know what floor they're on, you can just call like 0 at the hospital and say, I want to talk to the nurses who are on the 8th floor where my mom is, or where my aunt or my sister is, or my friend. And there's other ways you can connect with them without going in person. Sometimes, depending on what hospital it is, they might allow one visitor, but they probably won't allow more than one. And the rules change. So maybe the rule this week is there's one visitor, but maybe next week they have a different rule. So you always want to call before you go in to find out what the rules are, and think of other ways you can connect with the person that you love, the person that you want to see, even if you can't go there to see them.
That's really important point that you brought up, that like, yeah, maybe the rules are changing very regularly. So call ahead that you don't get turned away at the door, and that would not be fun either, right? So you want to make sure that you're able to connect. And
they also might have different rules. If you do end up going to the hospital either yourself because you have to be in the hospital, or to visit somebody. They might have rules around things. You'll see that some people might be wearing masks in some areas, or they'll be asking more questions, or they'll be taking your temperature and asking you about how you've been feeling. So it works a little bit differently now. It will take longer to get into a hospital.
Yes.
And where you wait and how you wait and who you can see. The rules are changing a little bit, and it can certainly be ready for it to take more time.
And the next couple of questions are a little bit similar, I guess, in like saying that like if I can go visit people, how do I keep in touch with them? How do I talk to my friends? How do I talk to people at work? Just communicating. So what are the ways that we can do some of those things? And here, I guess we want to really say that, like, in today's world, there's so many ways that we can connect to one another outside of meeting each other. Um, we can do the classic things of calling people on their phone or texting them. Other things that we can do, there's a bunch of apps that are out there. So there's FaceTime where you can video call and it feels like you're in the same room because you can see and hear the other person. And a lot of other apps have those capabilities. So things like WhatsApp, Facebook has a video call function, things like Instagram, Snapchat, they all sort of have texting and video functions as well. So if you are already using some of those apps, them to do video calling with some of the people that you're connected with or that you want to keep in touch with.
But it might be like you may not know how to use some of these things yourself, or maybe one of the people you want to talk to doesn't know how to use it. So when we heard this question and when we were talking with some self-advocates, they said, well, I know how to do some of the stuff, but like my mom does not know how to do any of it. Mm-hmm. Well, I hope my mom's not listening, but she doesn't know how to do a lot of these things either. Mm-hmm. So sometimes you can teach other people how to do these things. And sometimes you just use the phone, you know, or you can even make like a letter or a card and like get it mailed to somebody. But I think for sure it is good to learn how to do these things. And if there's somebody that you live with or somebody that is visiting you or helping you, they might be able to show you how to use some of these things. Because it can be fun. You can, like right now, Irfan and I are not in the same place, but we can see each other to make this video. And we could even have like a meeting with, you know, 6 people or 10 people, maybe who are used to doing the same activity together. But they would connect, you know, through a video. So like if it's your sports team and you guys don't have a regular practice, you could all meet on video using some of these different programs where you'd actually still do the practice. You just do it, each of you in your own house.
Yeah.
Right? So that can be kind of fun.
Yeah, I think like I did this yesterday where I was having dinner with a friend, but he was in Hamilton and I was here in Mississauga. So we were supposed to meet up, but instead we met up online where we were both eating in front of our computers and talking to each other while doing that.
Were you jealous of what your friend was eating?
A little bit. We shared pictures as well to show each other exactly what we were eating. So we made each other a little bit jealous of like who can cook better, but it was fun. It was nice to see them after a long time. So it can be really fun and a nice way of connecting with each other, even though it's hard not to see each other in person. I think this is a good alternative and a nice way to sort of keep in touch and talk to people, connect with the people we care about.
Yeah, and I think we have to get creative. We're doing different things. We've never really been in this situation before. Yeah. So we have to try new stuff, but we would love to hear if you try something that works. So I've heard a lot of neat ideas of things people are doing to try to connect with each other. And if you figure something out that helps you with your schedule and your routine, and staying in touch with other people, let us know what that is. So this last slide just has some information for us. We have Facebook and Twitter. We also have Instagram for HCARD. We have an email address. And if you want to get in touch with us, you can tell us what kind of stuff you're doing, and we'll try to share that information with other people. So thanks for watching this video. We hope you liked it and you learned a few things. And if you have more questions, you can always send those questions to us, and every week we're going to make like a new video answering new questions and talking to different people.
Yeah, for sure. And if you like this video, share it away.
All right. Stay safe, stay well, and stay connected.
Stay connected. Amen.
Okay, all right. Bye, Irfan. Nice to see you to do this video.
Take care.
Bye.